Thanks for staying with us. Well, November 14 globally is a day that has been set aside to commemorate and spread awareness and advocacy for diabetes. Well, today we're continuing the discussion on diabetes, and we are going to be discussing management of diabetes, well, especially in Nigeria. And Dr. Obumneme Anyim is in the studio to throw more light on this particular conversation. Good morning, Dr. Obum.
Good morning.
Thank you so much for joining us this morning.
My pleasure.
All right, so before now, we've had a lot of discussions and conversations around diabetes, given the fact that this is Diabetes Month. Of course, November 14 was 14th, Diabetes Day. All right, could you tell us, because we're told that it's a day where we spread awareness, because we feel many people are not aware, and then the treatment is not readily available and easily affordable. Okay. And then is a day where you advocate and ask the government to see how they can help in the management and treatment. So tell us, what were the activities that you guys had lined up and that you did or carried out to ensure that this day was well commemorated, talking about November 14?
Okay, like you said, it's a period set apart for to make people aware of the ravaging effects of diabetes and to educate people on diabetes and to get the government to actually look at the subject matter. So we did a screening, free screening, and educated people living with diabetes and relatives and all other people as well on diabetes and well-being, as is the theme. And then also measured some other things like blood pressure and what we call anthropometry. That's the weight and the height, because diabetes has a bearing on that.
Really?
Exactly. Like I was going to say that diabetes is the third most populous call it country or world. What I mean is that China is the most populous country, of course. That's by 1.4 billion. And India is 1.2 second, and then diabetes comes next at 537 million people living with.
So if diabetes were to be a country, it would have been the third most populous.
That's amazing.
Wow.
Yeah, exactly. And it is rising and rising and rising as well. The problem we have is that Africa, as it is, will experience the worst surge from the data presented. That by 2045, Africa may record about 134% increase.
And that's double of the statistics currently.
Yeah. So you understand, and this thing is all about our way of life. What we do, so lifestyle essentially.
Okay, but before you go down that path, can you tell us some of the activities that your group or your association carried out to ensure a little bit of awareness and advocacy of diabetes just this past week that Diabetes Day was celebrated?
Well, like I said before, we educated the public on the things that can predispose them to have diabetes, things to do to see how they can prevent it, and then talked about management of diabetes, which I understand I will still talk on today.
Yes.
And then did those measurements, free screening of diabetes, because the free screening is very important. Many people do not know that they're actually living with diabetes. People will live with diabetes for down the line for about 5 years, and they may never know.
Can one screening be enough to say, hey, this man has diabetes?
No, one screening is not enough. If you do a fasting blood glucose and it's elevated, you will need to repeat it another day. And if it is still elevated, then yes.
Okay,
so one screening is not enough.
From the tests your group conducted, what were the results you found, and what were the worst cases you had to see?
Well, the worst cases that we had to see, well, most of them already have diabetes. Because the way we anchor it is we do it on the day we see diabetic patients. That's on Wednesdays in UNT. So most of them already have diabetes and, well, on management as well. So the great majority of people you will see already have diabetes. The only ones that you will catch that do not have are just people passing by and
decided to
walk in.
Okay.
Yes,
so what's the risk management? Sorry, before you go, what's the risk management for someone who had, just like you said, somebody had already had it for 5 years? What can that person do at that point to manage the situation?
Okay. Maybe we say what are the risk factors, and then what should
Well,
somebody
before we
do
get
to
to the
manage?
risk factors and then probably management and treatment, can you give us like a mental picture? Assuming you, of course, in giving you experience, you must have gone on one outreach or the other to screen patients. Can you give us like a mental picture of prevalence of, heightened blood glucose, among the cohort, among the population that was tested? Is it usually high? Do you come in and maybe more than 50% that have high, glucose levels? So just run it by us. Let's understand.
Well, I won't say more than 50%.
No, I was just trying to explain.
What
Tell
you
us.
rather get is
Yes.
like when you get about 10 people now, you find maybe 1 out of
1 in 10.
has diabetes. And well, the national prevalence for diabetes, that's in Nigeria, is 4.99%.
That's high.
That's very high. Bearing in mind that at one point in time,
We're
it
talking
was 2.
over 4 million
Yeah.
Nigerians.
So in Africa, Nigeria has the highest, but of course you must recognize the fact that we have the greatest population. So that of course has a bearing on that.
All right, so what are the risk factors?
Okay, I like to start with sleep because I noticed that a lot of people do not sleep well anymore.
I just feel like that's a personal attack to me.
Wait. Would you say it's lack of sleep or stress
No, lack of
caused
sleep.
by lack of sleep?
I would say lack of sleep. Stress has its own, but lack of sleep has its own as well. Now, let me explain it this way.
I need to pay attention to this.
A lot of people, well, as we grow older, there's a hormone that helps you to sleep that God put there, melatonin. You have
It's
it.
part of the feel-good hormones. Serotonin.
Helps you to sleep. That's the basic function of the hormone. So as we grow older, the level drops. Okay, but then again, you understand that as we grow older, a lot of things are on your head.
Yes.
Having to provide for the people that are dependent on you. So when people do not sleep at night, stress hormones are released to keep you awake. You understand? And that stress hormone drives up your glucose level. So over a long time, the person can develop diabetes. Not only diabetes, a lack of sleep is also a risk factor for stroke, heart attack, hypertension, all of that. So what we need is 6 to 8 hours of sleep every night. Yeah, to mitigate against this. It could be like you got it in one shot or in snippets, and by the time you bring them together, it's up to that level as well. So then the other thing is lack of exercise. I tell people, like when we had the World Diabetes Day, that God made us in such a way that we have 2 legs that can run.
Have to move.
I can run. Could have created a human being that has no legs, but we have legs. So the way our body is created is optimally you need to move around. So by the time people sit in one place, they don't do anything, lack of physical activity, what you find is that the person is promoting diabetes or helping diabetes or any of those metabolic diseases to come in. Now, I said something to, a younger person, that television used to start by 4 p.m. and the person could not understand what I meant that television actually used to start by
In those days, before
exactly.
DSTV.
I don't even know whether you are aware of that.
I am aware of that.
I am
aware of that. You are not aware of it. I'm aware of it.
So, and what you find is that by that period, the television is not on. So we will be playing football and all other activities, developing our motor skills. You understand? But right now, the children of now, it's the tablet, it's the phone, of course, it's the screen.
Yeah. It's a smart screen.
Like too far.
Smart TV.
Yeah. Great. Their brain is getting better developed. A lot of knowledge.
But it is said that physical activity has a positive feedback to mental health.
Exactly. Okay. So that's what you're, like in Africa, our major problem is that lack of physical activity.
Really?
I give
in
you
Africa?
Yes. You're the madam in your house. So you get home. Maybe, have you put out water for me to have my bath? You will not take the water in yourself. Okay. And you're sitting down here, the remote is over there to change the channel. And then you're calling somebody to pick it up as the big madam before you change the channel. You may even tell the person to change it for you.
Very true.
Stop lying. Stop laughing as if I'm the one doing this.
So, and you now see as we still advance up, the vehicle will park just by the door of your office. As you are lighting, the aide will open the door for you and you step inside, done nothing. You relax. You get home, they'll open the door again for you.
Run your bath.
And then you
serve your
inside.
food.
So nothing is done. And we think it is life and well-being.
I just wanted to say that, so in quotes, this I'm a big boy living a soft life is not actually a soft life.
It's not. It's not.
Okay, so you've mentioned stress, lack of sleep, sedentary lifestyle.
And then the next is overweight. So as people grow bigger, of course, this the lack of exercise, of course, breeds overweight.
Obesity.
Plus what we eat. Okay, trying to taste it all and enjoy it all. So overweight has a very strong bearing on
developing
diabetes. Actually, if somebody is overweight, ADA, that's the American Diabetes Association, says that you need to screen for diabetes every 3 years. As if you screen and the person is negative, of course, next 3 years, screen again. So obesity is overweight is a strong factor in development of diabetes.
So yesterday on the newspaper, it was said that about 6 million Nigerians are waiting for death. This was how it was placed, simply because they have diabetes, of course, but the cost of treatment is now high.
Okay. I want to say something to that. Actually, the government needs to do something, really. I manage people with diabetes, and the cost of the medications have gone up so much. I knew when I'm talking about insulin, the pen type that is easily used, when it was sold for 3,000 naira. That pen insulin is about 15,000 naira now.
For a
just
dose?
One pen, not a dose.
A pen.
Yeah, it depends on the person's need. Like somebody may use that pen for 1 month. Okay. Another person may use it for 1 week, depending on, like the person's need. That's the dose the person injects himself with. Some other medications of diabetes, just one medication, go for about 30,000 naira. So it all depends. And then the problem again is that people living with diabetes, diabetes is one thing that affects about everything in the body. So people living with diabetes, they may need to deal with their cholesterol level. So another pill coming in. They may also have hypertension, another pill coming in. They may have the other complications of diabetes.
Some of these medications counterproductive?
No, they are not. They will help the person. But what I wanted to say is that in 2013, the WHO Global Observatory data presented that people living about 1.5 million people living with HIV/AIDS died. That's as a result of HIV/AIDS. That's 2013. The same WHO Global Observatory data presented that tuberculosis, about 1.5 million also died. The same WHO presented that for malaria, well, of course, it would be more in around our place. About 0.6 million died from this. Now, these diseases I mentioned, that's AIDS, tuberculosis, malaria, that better called ATM diseases. Government is doing something about all of them. HIV, of course, tuberculosis, they get the drugs free. Where malaria, you have some programs
Pockets of
being done.
intervention.
At least now we have vaccines for 0 to 5.
But you see, for diabetes, IDF, that's the International Diabetes Federation, mentioned that in 2015, 5 million people living with diabetes died as a consequence of
Poor management or
diabetes and all that. 5 million as against 1.5, 1.5 and 0.6. And yet nothing.
what would you
is
attribute
done.
that dynamic to? We will have data on one hand, higher data that suggests that this is a public health concern, yet not much attention is given to it. What would you, is it that there are not enough advocacy, or what really could you attribute this
There's definitely
to?
enough advocacy, and
So what's the problem?
diabetes predated HIV/AIDS. Been there.
Definitely.
Been there. I wouldn't know about tuberculosis and, of course, malaria. They've all been there, but diabetes has been there for long. Well, the government chooses what the government will choose.
But they
Of
choose
course, you
based
know-
on data.
I know, I'm coming. You know that one, for HIV, when it came in, it was not funny.
Yeah, it came very
It wasn't
aggressive.
funny. So you can understand why the government embraced it. And it wasn't even our own government. It came from outside. So you can understand that. All of them actually came from what? Outside.
Could it be
Now-
because maybe these other ones, the ATMs, are somehow communicable and this is non-communicable, so they feel there's
But
no much
malaria is
threat?
not
No, malaria is communicable.
It is.
Yeah. Parasite.
Oh,
Malaria
okay,
parasite.
okay. Yes.
So I think that is the noise HIV made when it came in. Like you say, communicable, it's going to spread. People were afraid.
We're afraid.
For malaria, it was killing more of young people.
Especially children under 5.
Children, yes. So you can again understand
Yes.
that. And of course, people are afraid of bugs, TB. So I don't want it to get to me or get to the next person. So we need to do something about this. Diabetes, on the other hand, you can see with the person.
But that's the wrong premise to base decisions.
I agree.
All right, let's talk about, I need you to run us through a particular process. If someone, maybe in one of your outreach programs, someone has really high sugar level, goes for a second testing, really very high, walk us through the management and treatment now. We've stepped away from diagnosis, the right diagnosis has been made. Run us through the treatment and management of this person to ensure that, I mean, it doesn't escalate and of course it doesn't kill this person.
Okay. To manage diabetes, you need to look at 3 things. Okay. I call it the 3 Ds. So
You're such a good teacher.
thank
First
you.
it was ATM.
ATM.
Now it's
and
the
I
3
have
Ds.
ATM in my head. You wake me anytime and I have ATM in my head.
Okay.
Beautiful.
Well, thank you. So the 3 Ds. So you have diet, very important, and then daily physical exercise, and then the drugs. So I'm going to talk on all 3 of them. Okay. For the diets, when I was younger and growing up, and then younger doctor, I used to hear that once you have diabetes, you don't eat anything that has
Starch.
sugar. And you can imagine how dreary life will be for such a person. terrible. Now, that's not the case.
Really?
Yes. So, two things you
Okay,
look
sorry,
at.
sorry. I don't mean to cut you short. Because someone listening to you doesn't understand what you just said. Could you break it down? They say don't eat this food, don't eat this food, don't eat this food, only eat this one, only eat this one. So just break it down to that level.
I will.
Okay.
So you look at two things. One is what you call glycemic index. I will explain what it means. And then the other one is the glycemic load. Okay. Now, glycemic index just talks about how rapidly what you take in is digested and absorbed
By the body.
by the body. So if it's done so fast, it means that you have a sharp rise in your blood, in the person's blood glucose.
Is that good or bad?
It's not, of course, it's not good. Yeah. So we would prefer food that will have lower glycemic index. Now, this is all relative to sugar. Sugar, like the way we know sugar, has 100 glycemic index. So once the person takes
quickly
it
absorbed.
in, quickly absorbed. So in chemistry, that's, well, people that did chemistry, the elementary chemistry presented something, say simple sugar and complex sugar, or simple sugar and polysaccharide, disaccharide, but just call it complex sugar, simple sugar. The simple sugars are not good. Reason is that once the person takes it in, the body will absorb it very fast. So it's like that sugar or the glucose. So anything that has the sugar or glucose in it will have the same effect because the person will absorb that sugar very fast. Now, the other one, the complex sugar, when the person takes it, the body will take a process in breaking it down, digesting, and absorbing. So while this is happening, you see like rather kind of a slow release,
Okay.
not so sharp and
Okay.
inclined.
Okay.
Okay. So things with, so and now things with higher roughage content will also bring down the glycemic index. If you burden people with this food has this glycemic index, this one has this, so look at this one, look at this one, it's going to make it very cumbersome. You understand? Okay. So what we present is, so take complex what? Sugar, complex carbohydrate. So like the person can eat the rice. Yes, some are better, the brown rice or the father rice. So they are better. Okay.
You mean local rice?
Yes, local rice. It has more fiber content. And even when you come to yam, the regular yam we know is better than the water yam that people present as better.
Are you
in glycemic?
serious?
Yes.
The sweet yam is better than the water yam?
Yes. However, like what I'm saying, if people are made to, you know, just look at them, it makes it very cumbersome. So, but what you now see is that in a plate, you add vegetable.
It should be a balanced diet.
So, the vegetable is not about the balanced diet thing, about to give you blood. No,
Yeah.
the vegetable.
Increase the roughage so
Yeah.
that the level
So-
of intake will be.
A typical example is when you drink alcohol on an empty stomach, what happens? Your blood sugar. No. When you drink alcohol on an empty stomach, your body just takes it up. You're still seated there and you start feeling funny. Yeah. But when you're eating and drinking alcohol, the alcohol mixes
buffer
with the
defect.
food and cannot be extracted so fast. It's extracted slowly and your body can manage it as you're taking it. So the same way, the vegetable you add mixes with the food complex and the absorption is not so fast. So instead of a sharp rise, you have a slower or steep, not so high. And the body can easier manage that. So the person can eat, in fact, we say there's no diabetic diet.
Really?
So the person can eat the yam, the rice, the gari, the semo, all that.
It's an eye opener.
I'm telling
You understand?
Because we're made to understand that you only
Those
eat
things
ukwa,
have you can't stand.
unripe plantain.
Yeah, unripe plantain is better than ripe plantain. By the time the plantain ripens,
The sugar content.
the glycemic index increases. So it's better unripe. That you can at least manage. But talking about okwa, and beans. Those things are also carbohydrates. They are not really, as we call them, protein.
Beans.
Elementary biology call them protein.
Yes.
But they have carbohydrate. Like when you get the beans that we know, beans is about 1/3 protein and then 2/3 carbohydrate. So that is it. So none of them is complete.
You mean so all plant protein, none of them is pure protein, except
They all
for animal
have-
proteins?
Except for animal protein, exactly. You got it right. So the next thing we bring in apart from the glycemic index is now the glycemic load. Of course, look at it. You bring food that you don't absorb it so fast and then give a smaller volume such that our body can handle it. So we have a plate model. On that plate, you say that vegetable will be half of the plate.
50% of the plate.
50% of the plate. And then the food the person will take will be 1/4.
25%.
25%. And then protein like meat or fish is 25% as well. So the food is smaller and the person has some vegetables. The vegetable helps with the glycemic index, like I said, and the smaller food the body can eat. It's more or less like you
Reduces the
take
load.
fuel that you can use, not fuel that you go and store. Do you understand it? So what you just took now, you can handle it easily.
So is it safe to say that dietitians should be part of the professionals rather that
Absolutely.
manage?
Absolutely, they're part of it. So like in a full diabetic clinic, you have dietitians, you have what we call the diabetic educators, diabetes educators. They are like nurses that will educate, every day, teach people again, remind them. A pep talk on these are things you ought to be doing. Then you have the doctors as well. You have the people that talk about the foods and manage the foods, because diabetes can affect.
Can people afford all their services?
That's what I'm saying. Because I want to know if there is, of course, those 6 million people were raising concerns. What is the best alternative to getting drugs? Of course, you've discussed about how to eat now, more vegetables, less of the
So
food.
we should be talking about how to prevent diabetes.
But we can't just necessarily, those who are there already now, would you advise them to, do more of exercise? I think yesterday, during the conversation we were having, she asked about, these bitter colas and all of that. What can they do because we don't want to lose 6 million people. What else can they do? They can't afford the drugs. Government has not answered to, subsidize the price for drugs. Agreed. So what can they do?
Okay, the exercise must be there, the food must be there. Sometimes just the exercise and the food alone can, depending on how bad the situation is, like the person's need. If the person's blood sugar is it's not that high, you can use both to manage it, just exercise and the dieting. But if the person needs drugs, the person needs drugs.
Wow.
Again, talking about drugs, drugs are expensive, but thankfully we also have what we call generic drugs. Generic drugs are, usually when an innovator company brings out a drug, it's very expensive. Understandably, they spend billions to produce
And
this
it's
drug. They're going
patented,
to
so
recoup
they
their
cook
money
them before others.
So by the time their patency expires, then other companies are allowed to produce it. So they just take the molecule, they didn't do any work as such, and now the work they're doing is to produce them, and it's cheaper, much more cheaper. So indeed, the government needs to help. The government needs to help. In some other countries, of course, where the NHIS works better and all that, you see the help coming. In our country, NHS also, yes.
NHS covers less than 5% of the population, so
I know,
it's
but
like a needle in the haystack.
but it is what it is.
It is what it is. Tell us about alcoholic beverages.
Okay.
Should a diabetic take some kinds of beverages just like you mentioned, don't run away from all carbohydrate. Maybe they can take vodka or gin or whiskey. Don't mind me. Please tell us about the effect of alcohol on a diabetic.
Alcohol, the problem is not necessarily the alcohol. The problem is the sugar additives
In alcohol.
in alcohol. So, and for you to make a drink with a good blend that touches your palate and
Oh my goodness.
you feel
Are you a wine taster?
I'm not that you will enjoy even when it is bitter. You need it bitter sweet, so that becomes a problem, so they shouldn't take it.
How about locally made drinks like palm wine?
Brukutu?
It's still, as long as they have some level of
Sugar.
simple sugar fermented and gotten that,
Yes, yes.
it's not very healthy. People with diabetes can snack, but I tell my own patients, do not snack.
Because you can't control the kind of snacks
Because
they take.
you eat your breakfast, then after 2 hours, you want to munch something, the blood sugar is going to go up. After another hour, the blood sugar is going to go up. So the idea is eat, allow your body to rest. You mustn't be eating all the time. So eat, allow it to rest till afternoon, allow it to rest till night. Sometimes I've found that people that have diabetes eat more than people that do not have. I've been in the ward one of the times, and I was to see this patient. That was around 11 a.m. That wasn't the first patient I was to review. So this patient was on the bed and eating moi moi. The blood sugar was 200 and something, and I was trying to
And that's high.
yeah, let's find out why it's 200 and some. Let's talk about how you eat. The woman threw away her face. So I asked the son, is this your mother's breakfast that she's having?
He said, no, this is the preamble.
And he said no, that she took up in
Before
the morning and is now having this as a snack. I asked the son, have you eaten yourself this morning? He said no. But the woman was having a helping and was lying down on bed, not doing anything. So the idea of trying to bring more food is just to have, by the way, you won't even tell your children to go drink all those things. You just want them to eat a balanced diet, which has been provided and allowed and is good for them. Yeah. So the alcoholic beverages, the problem is if it has sugar in it, it's not safe. It will affect the blood sugar.
All right. Aside challenges with procurement of drugs, expensive drugs and things like that, what other challenges do healthcare providers such as yourself encounter in trying to manage your patients? And I want you to take it from the angle of adherence.
Okay.
Yes, to drugs and to lifestyle changes. What has the experience been for you?
Okay. We have the social media has not helped. A patient comes to you and tells you that I heard that metformin has been said that metformin does this or does the other
ChatGPT.
one. I know, right? So, and then you have AI used to get a notable figure to now say something that is totally incorrect, and the patient forwards it to me. What is your view on this? So this has been a huge problem, trying to get patients to understand that these things that you hear all the time, you need to vet the authenticity, you need to vet the authority of the person saying it, that the internet is more of, that if I push out that Dr. Obumneme Anyim is a stupid man and send it out there, once you type in Dr. Obumneme Anyim, you will see
Pops up,
he's a stupid person. Am I a stupid person?
Not at all.
So you need to look at the authority behind that statement. Who is saying it?
for every data or research, whatever I put out, you need to check the people that are formulating it.
Somebody had put out something in a group I was in, and there he just put out that P-alaxane,
that's a drug for malaria,
causes kidney disease.
I think I've heard that too.
So I tried to ignore it. I couldn't. So I mentioned, I wasn't addressing the person that posted it. Just say that whoever that created this, if the people that made P-alaxane should come after him.
Maybe they want to demarket P-alaxane.
That he will say that his village people, that they've come. So, but the person that posted it now came up and started defending it. So I explained to the person that, for starters, it's not an individual that will mention such a thing. It has to be a body that oversees these things, that are in control of the drugs that are marketed in so and so place. It has to be in our place, NAFDAC, that will tell you that they found out that P-alaxane does this, and so they are recalling it. I'm not an individual. This person that possibly in quote took P-alaxane, does this person have hypertension that could have caused kidney disease? Did the person take any herb that could have caused kidney disease? So that is not the case. And meanwhile, P-alaxane is very safe. Okay, so we have the social media creating a lot of problems. And then people, again, bring in the issue of herbs. You know, we want something that is what? Natural. That these drugs you're talking about, that they are
synthetic
compounds, that they are not okay. Not understanding that the drugs we have also came from natural things. Like you get crude oil, it's natural. And then
process it.
you process it. You have your PMS.
Yes.
Is PMS now natural? And you have your bitumen and all the others. Then, so we have all these factors. And then again, people come, if I take my drug, doctor, and it's normal now that I have taken it, should I continue to take it? This happens with hypertension. This happens with people also with diabetes. So if I take it again, will it not push it down further?
It actually
Doctor,
makes
I don't understand.
theoretical sense.
So then they don't understand. I explained to them that one, like most of the drugs for hypertension and for diabetes as well, they will last for an hour. No, not an hour, 24 hours in the body. That's a day, majority of them. Of course, some last for less, but largely 24 hours. So if the person takes it, it just controls for that 24 hours. Afterwards, the body will excrete it. I give you an instance. When you swallow something like amoxil, or you swallow something like ampiclos, you go to pee, you pick the smell of the medication, because this one, you can pick the smell. Some others, they don't smell.
But they still go out together.
So after 24 hours, it leaves the body. So what is the person supposed to do? Take another one. So it's like people running a relay race. You carry the baton, you hand over to the next person.
What I've been made to understand is that you don't just treat, you also educate.
Yeah, you have to. You cannot manage diabetes without proper education.
Our time is up, and we're having such a good time. But I'm sure we'll have other opportunities to discuss more on this topic. Thank you so much, Dr. Obum, for joining us. All right, I'm sure you must have gotten a thing or two from our discussion on management of diabetes. Don't go anywhere. New Day continues right after this time out.